German Gonzalez. I'm going to be doing the nasal tube, and what I'm going to be doing is basically checking the patient's orders. I'm going to wash my hands, go to the patient's room. I'm going to introduce myself, check the patient's ID band. I'm going to advise him of what I'm going to be doing. I'm going to provide him with privacy. I'm going, in this case, wash my hands, don some gloves. I'm going to prepare the station, basically make sure I have a mat down. I have my syringe and my container, and I'm going to have some saline solution. In this case, what I'm going to do first, I'm going to check the patient's nasal. I'm going to make sure that it is all right. It's not, the tube hasn't dislodged, the tape is correct, he doesn't have any, rash or any open cuts or anything. It's fine. What I'm going to do next is I'm going to make sure that the bed is at the working position. It is. And then what I'm going to do is make sure that the head of the bed is raised about 30 degrees. I'm going to, in this case, take my syringe, make sure I have about 20 cc's of air, disconnect the patient, I'm suctioning, take, and I'm going to push. And what I'm going to do is I'm going to be listening at the xiphoid process, and I'm going to be listening to the left side of it. I'm going to be listening as I push in for the air to make sure that I hear the swoosh, to make sure that the tube is in the correct area. It is. I'm going to then lower it. I'm going to aspirate until I get contents. When I do have my contents, I'm going to take that, and in that contents, I'm going to check for pH balance as long as it's less than 4. Then what I'm going to do is I'm going to take about 20 to 30 cc's of water. Okay. I'm going to insert that. And what I'm going to do now is I'm going to bring it back. Okay, and what I'm going to be doing is I'm going to be inspecting for the color, the contents, how much, and the odor. And I'm going to discard that. Okay? And then what I'm going to do is I'm going to connect the tube back to suctioning. I'm going to lower the patient to a comfortable position. Make sure he has the call bell. I'm going to take off my gloves. Before I take off my gloves, I'm going to wash my equipment because it's good for 24 hours. And I'm going to put it away in a safe place. And I'm going to label it. And I'm also going to report my I and O's. And I am going to wash my hands and I'm done.